Hi, my name is Lavinia. I'll be presenting to you on the topic what happens to your body during pregnancy. So let's take a look at the first slide here and take a moment to observe the video. As you can see here, there are organs being compressed and pushed upwards. And then you can also observe that the tummy enlarged, and this is where your skin will continue to stretch. Then you can see right up here is where the lung is, and your lung space get reduced as your belly enlarge. And as the baby grows, it sits on the bladder and continuously put weight on the pelvic floor. We will talk about the pelvic floor in a bit more detail later on. Then you will see that there's an increased load on the lower back. Hormones are the cause of the major change in your body during pregnancy. So I'm going to go slightly more in detail in the hormone section. So hormone changes are necessary when it comes to helping you to produce milk producing cells. This is to help you in your breastfeeding later on after your delivery. Then it also causes you to increase in weight. You will get more detail about the weight increase when you hear from our nutritionist, and you will find out that the weight gain is necessary. So as you can see here is a picture of swollen feet. You will definitely get swollen feet at a certain point in your pregnancy, usually towards the later part of your pregnancy. This is due to because there's a lot of blood flow, there's increased volume in your blood, so the water needs to go somewhere. So when we're always on our feet, or our feet are always way below, so that's why it gets accumulated and you get a swollen feet there. When you happen to see this, or when you get the swollen feet, all you need to do is just sit back, relax, place your feet on a stool and just do some ankle palms until you see the swelling goes down. The next one will be extra or increase in flexibility. So flexibility will increase because of a hormone known as relaxin. It's supposed to help you to prepare your body, especially your pelvic area, to open up to be prepared for delivery. So if you are already a flexible person or a naturally flexible person, you will become even more flexible during pregnancy. That's why at this point we usually advise mothers not to do exercises that involves too much stretching. So then you can look at the change in posture. Okay, so if you look at the slide here, in the first picture here you can see that this is a normal posture of a mother, alright? And then as your belly grows here, you start seeing the change and your pelvic will start tilting forward. So we call this anterior pelvic tilt or forward pelvic tilt. So for here, it's when your belly has grown so much that your lower back develops a curve. And when this curve gets too exaggerated, it can cause tightness in your lower back, and this is usually the cause of back pain during pregnancy. I always encourage mothers to actually get a gym ball. So if you are 160 cm and below, if your height is 160 cm and below, you should get a ball that's about 55 cm in diameter. But if you are 160 cm and above, you should get a ball that's 65 cm in diameter. The reason for the ball is that if you're a mom who's still working in the office, you should try to get a ball and you can switch it out with your office chair once in a while. Why? Is because with the gym ball, you can see here, it helps you with your posture to keep you in an upright posture. So with this posture, you actually continuously activate your core, which is very important. And then at the same time, you can also practice your exercise known as the pelvic tilt exercise. So the pelvic tilt exercise you will learn more during the Pilates session. So with all this, with the gym ball, you can actually do a lot with it, and you can actually get your exercise done in the office as well.